Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Exercising for a healthy life. Introduction. Exercising and becoming more active can improve your health. People who are not physically active are much more likely to develop health problems. Exercising and becoming more physically active have many benefits. This is true for everybody, regardless of age, gender, or race. This program discusses the benefits of being physically active. It also presents exercising options and tips. Benefits. Exercise is good for you. It helps to prevent heart disease and type 2 diabetes. Exercise also helps you manage your weight and helps reduce stress. In short, exercising helps extend life and improve its quality. This section examines the benefits of exercising. Exercising strengthens your heart and lungs. A weak heart does not pump as well as one that is conditioned. A weak heart increases the risk of heart, lung, and blood vessel diseases. Several factors can cause heart disease, such as high cholesterol, high blood pressure, obesity, stress, diabetes. These are known as risk factors. Exercise helps to control these risk factors. Staying physically active helps to lower bad cholesterol levels and keep them within acceptable ranges. Exercise burns energy, which reduces weight and fat. Exercise helps people cope with stress, combat anxiety and depression, and feel relaxed. Regular physical activity can lower our risk of stroke. Regular exercise helps us feel better about our bodies. It tones the muscles. For overweight people, it helps with weight loss. For those who are not overweight, it helps prevent weight gain. Exercise gives us more energy by increasing our endurance. Endurance is how long we can keep exercising without getting tired. Exercise that can be done alone, such as jogging or swimming, gives us a chance to meditate and think about our lives without being interrupted. Team exercise helps us meet new friends and enhances our social life. Exercise improves quality of sleep. Types of physical activity. Levels of physical activity can be broken down into 4 categories. 1. Inactive. 2. Moderately active. 3. Active with regular exercises. 4. Active with regular aerobic exercises. Inactive people are those who do not get regular exercise. Inactive people may not get physical activity from their regular routine. They may choose not to mow the lawn or take the stairs. Inactive individuals are at the highest risk of developing heart disease. Any type of physical activity makes for a healthier lifestyle. Moderately active people get some physical activity from everyday tasks. These could include mowing the lawn, washing the car, vacuuming the carpet, taking the stairs instead of the elevator, or walking next door instead of calling on the phone. Aerobic exercise includes activities such as aerobic dancing, bicycling, swimming, walking briskly, stair climbing, running, rowing, and jogging. Some types of exercise provide a lot of benefits but are not considered aerobic. Examples are gardening, softball, walking leisurely, ping pong, bowling, and weightlifting. The body needs about 30 to 60 minutes of physical activity a day to stay healthy. By including activity in the daily things you do, you can maintain a reasonable level of physical activity that will significantly benefit your health. For the heart to be conditioned to pump the same amount of blood with a smaller number of beats, exercise should be done vigorously. During exercise, the heart rate is increased significantly. This is known as aerobic exercise. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Tips for starting. If you are inactive, you can start being more physically active by adding a little bit of activity to the things you normally do. Here are 10 tips. 1. When you drive to work or school, park as far from the door as you can and walk through the parking lot. 2. Take the stairs instead of using the elevator. 3. Walk to the mall instead of driving there. 4. Walk to your coworker's office instead of calling on the phone. 5. Take the stairs instead of using the escalator at shopping malls and the airport. 6. Mow the lawn and shovel the snow instead of hiring people to do these tasks. 7. Wash your car. 8. Vacuum the carpet and do housework more frequently. 9. Pick up your order instead of ordering through delivery. 10. Do some gardening and rake the lawn. Tips for exercising. Here are 10 tips for exercising. 1. Choose activities you enjoy. 2. Exercise for about 30 minutes a day. If you need to, divide up the time into 3 10-minute sessions instead of 1 30-minute session. 3. If you have not exercised in a while, begin exercising gradually to give your body a chance to get ready for more vigorous workouts. 4. Warm up and stretch before exercising. 5. Exercise at your own pace. 6. At the end of your exercise session, slow down gradually. 7. Do stretching exercises after your workout. 8. If you miss a few sessions, restart at a lower level than before. 9. If you get bored with your current activity, change to a different exercise. 10. To lose weight, it is important that you cut down on the calories you eat in addition to exercising. Resistance training. Weightlifting, also called resistance training, is recommended for all adults. Here are a few tips. 1. Do resistance training 2 to 3 times a week with at least 1 day of rest between sessions. 2. Start each session by warming up for 5 minutes. 3. Start with weights that you can use comfortably. 4. Pick a set of 8 to 10 exercises that exercise the major muscle groups: arms, shoulders, chest, abdominal muscles, back muscles, hips, and legs. 5. Follow the safety instructions on the equipment. Ask for directions if you do not know how to use the equipment. 6. When exercising, exhale as you lift the weight and inhale as you return the weight to the starting position. 7. Repeat each exercise 10 to 15 times until the muscles are fairly tired. 8. As you gain strength after several sessions, gradually increase the amount of weight or the repetitions. 9. To build endurance, increase the number of repetitions without increasing the amount of weight. Aerobic exercise. As we exercise, our body requires more oxygen. Our heart has to work harder and faster to deliver more oxygen to our muscles. As our heart works harder to deliver oxygen, our heart rate goes up. The fastest your heart can beat is known as your maximum heart rate. Maximum heart rate varies with age. A quick way to estimate yours is to subtract your age from 220. A 40-year-old person has a maximum heart rate of 220 minus 40, which equals 180 beats per minute. The goal of aerobic exercise is to increase the heart rate to between 50 and 75% of the maximum heart rate. This is called your target heart rate zone. Therefore, a 40-year-old person's heart rate should be between 90 and 135 beats per minute while exercising. It may take a few months to reach your target heart rate zone. It may also be possible to push your heart rate up to 85% of your maximum heart rate as you continue to exercise regularly. You can measure your pulse by either feeling the carotid arteries in the neck or the radial artery in your wrist using your fingertips. Count how many pulses you feel in 15 seconds, and then multiply that number by 4 to get your heart rate per minute. If your heart rate is below your target zone, you should increase the intensity of your exercise. If your heart rate is above your target zone, you should decrease the intensity of your exercise. If you have any medical conditions, you should talk with your healthcare provider before starting any exercise program. Some medications lower your heart rate. In a case like this, you would want to adjust your target heart rate zone. Exercising safely. When done correctly, exercise involves few risks. The following are some tips for safe exercising. 1. If you have heart disease or were born with a heart problem, consult your healthcare provider regarding the type of exercise you can do. 2. You should stop exercising immediately if you start feeling pain or heaviness in your chest or neck. This may be an early sign of a heart attack. Pain in the left shoulder or arm is not normal either and may also indicate that a heart attack is approaching. 3. Exercise may stress the joints, causing knee and ankle pain. It is important to exercise safely, being careful not to overexert any specific joint. 4. Learn about safe techniques for using exercise equipment. 5. If you start feeling dizzy or lightheaded, this may be an indication of heat exhaustion. If your body temperature becomes high and sweating stops, these are signs of heat stroke, which is more serious. In either case, you should rest and drink some fluids. 6. In cold weather, wear warm clothes if you are exercising outside. 7. Wearing good quality shoes that are suitable for the exercise you are doing helps protect your joints from stress and pain. 8. Wait at least 2 hours after a regular meal before exercising. Wait at least 20 minutes after exercising before you eat anything. 9. It is important to use safety measures such as wearing a helmet when riding a bicycle and goggles when playing racquetball. Also, use front and back bicycle lights if you are biking at night. 10. Use common sense when exercising. Don't jog on icy roads, don't walk on unsafe, dark streets, and don't ride a bike on busy streets.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Today, fewer and fewer jobs require significant physical activity. Therefore, most people get little vigorous exercise at work. Regular exercise helps condition the heart and lungs, helps prevent heart attacks, and helps reduce stress. Starting an exercise program can be made easy and successful if you select activities you like, start with realistic goals, gradually increase the intensity of the exercise. The short-term and long-term benefits of exercising make it well worth your time. Thank you for using Explain.